morning, good afternoon, committee chair, members, Dr. Jones, and staff. I'd like to thank you all. My name is Robert Miller, and I'm a CFS patient. I've been ill for over 20 years now. I'd like to thank the Assistant Secretary, Dr. Coe, for attending our meeting. It's the first time in over 4 years of my attending in which we've had the Secretary or the Assistant Secretary attend. And I hope that Dr. Coe will follow CFS and CFSAC closely, as prior administrations have failed to give this patient population of 1 to 4 million people the medical concern that we deserve. I also want to thank the Secretary of Health for undoing the neglect we patients faced from the CDC by removing Dr. Reeves from the CFS program. It's the first real step our government has taken to validate my illness. I welcome Dr. Unger, and at the same time, I expect the CDC to aggressively make up for the 20 years of lost time. We do not need any more head counting. We have a moment to seize here, so be bold and fund real research. Dedicate $100 million in NIH grants to CFS researchers who've given up on federal funding due to neglect. Help expand private research, which has propelled the current XMRV discovery and My Hope, which is what we should be discussing here today. You have miles to go before we patients say that our government takes CFS seriously. I was set to attend in person today, but my health prevents me. I had to move back to Reno last year from the D.C. area to be treated by one of the very few doctors who truly knows this illness, Dr. Daniel Peterson, and to the only facility where I could return to Ampligen, which I was just infused this morning, a drug which has been stonewalled by the FDA for over 20 years. Again, I ask, how is it that Ampligen has been safe enough for patients to self-pay and use for 15-plus years, but the FDA is still asking for research on lab rats? That's insane.
You have 1 minute, Mr. Miller.
Thank you. The FDA should be coordinating clinical trials for this serious illness, but it's chosen to be in the way just like the CDC was. As for the requests from April regarding input for the charter, the problem's not been the charter, as clearly CFSAC has been doing their part. The meetings must remain as 2-day meetings to be truly productive, and an extension for some members would be key in keeping CFSAC moving forward, as Dr. Snell has suggested. The only way CFSAC can function properly is if they get a response and action from the Secretary. Otherwise, CFSAC is invalid. So I suggested the charter that it state the Secretary will respond to all CFSAC recommendations directly or through the Assistant Secretary. Confirm the recommendations or deny them, but there must be a response to CFSAC from the Secretary of Health. Our lives and families depend on it. Thank you.